Hello, and welcome to another episode of Hour of Healing. This is your weekly host, Joe Debra, and we are continuing our conversation with Dr. Norma Obona and Dr. Christine Tolu Ajayi about the topic outward smiles and inward grimace. We're talking primarily about the paradigm of medicine, but this cuts across many walks of life because we find that most of the time we sign contracts after grad school, after college, and we don't pay attention to the nitty gritty things. So, if you are listening to us and you are about to enter the workforce, I implore you to go back and listen to part one of our conversation. We learned so many things. The fact that setting boundaries is very important. Having a contract lawyer, something that most of us don't think about until we start the work and things start going haywire, then we start thinking about those. But so many things that our panel or our guests did help us understand or have an idea about. We are continuing our topic from where we left off, as we were talking about in the medical field, the difference between the APPs and the physicians, and the fact that at the end of the day, this is a team engineered to make or create access to patients. But most of the time, we have patients in the dark. So I want to pick up from there and ask Norma our first question, that whose responsibility is it to make sure that our patients know who they seen, that the difference between the doctors and things like that? Is it the patients have to do the research on Dr. Google, or who is responsible for making sure they are informed about these differences and what they should be expecting?
Everybody involved has to take responsibility for learning. So the health system should be able to outline these things specifically whenever, a visit is coming up or who you're going to be seeing. So health systems have that responsibility when they come in and they see the provider or physician. I really don't like the term provider because there's a huge difference. Physicians are physicians. We go to med school, so we didn't go to provider school. So physicians, and then non-physician advanced practice providers. So I think those are more appropriate terms. And then the patient should also try to learn about these things. So along that whole continuum, everybody should take responsibility for learning. So I try to explain those things to patients, especially when they might come in and be a bit frustrated about some prior experiences they've had with different people. I try to give them the definitions and explain the reality of things so that they understand. So I've had to do that even with patients who come in and they speak ill of another physician. And there is an unspoken code for physicians where we don't speak ill of each other.
Correct.
We, as much as possible, support each other. When we don't know what the situation is, we don't speak on it. So I just try to be very neutral and I tell them, look, I don't know what happened, but again, this is how medicine is today. And a lot of times they appreciate it. So for example, I tell them about, hey, a lot of health systems have give 15 or 20 minutes to a physician who's employed under them. So it's not them who are not wanting to spend a lot of time with you. It's
Mm,
because
mm,
that is already set out for them. They're not in control of their schedules. And patients actually, like a light bulb comes on and they actually start to understand things better and it calms them down. And they're a
mm,
lot more rational about things and they're willing to now have more in-depth discussions. So a lot of it is how you explain things to them, because a lot of people want to learn and sometimes we get miscommunications happen and we get things crossed, and a lot of it is just your approach. If you come out and you talk to people, as much as possible, they're willing to understand and learn. So everybody has to share responsibility for educating anyone they meet about these things.
wow. Thank you so much for that. Now, Christine, I want to ask you, since we ended our conversation last week about the patients and we picking up from there, um, how about the customers? I know in America there is this saying that the customer is always right. And so here you are, you've gone through trainings and all those things, and you know that what the customer is saying or what they are demanding is not necessarily right. how does the businessman or for physician like yourself, what your patient is demanding is not right? How do you go about it? How do you deal with these complicated and entitled patients or customers? How do we go about them?
Well, first of all, they are patients and they are not customers. So I always have that at the back of my mind. This is not McDonald's. You're a patient. I'm the doctor. That's it. And so I always try to explain that role. And like I told the patient, I said I went to medical school to learn all these things so that you don't have to. So you can trust me, and I'm going to try and do my best to make sure that we help you and get you the care that you need. And
Mm,
so when I try to explain it that way, they're a little bit more understanding. Of course, there are going to be people who want what they want, regardless of what you're going to say. So you just have to be firm in your decision making, especially if it's appropriate, which is going to be, most a lot of the times your decision is going to be appropriate. So you have to be firm. I try to explain the situation, but a lot of times that's not what they're not looking for an explanation. The person just wants what they want, because like you said, we live in a very entitled society. So you're paying to see your doctor, you've waited 2 months or whatever, however long, to see the doctor because you want this particular thing. And then you come in, and then you are being told, okay, no, this is not what you need, this is actually what you need, and this is actually better. And your mindset is already, this is what I want, I got it in the past and I want it now. And so it's a very difficult transition. But diplomacy comes in, and being firm, setting your boundaries as the physician. And then, at the end of the day, you can say no. If they don't like it, then it's unfortunate, but you are there to help them. And I think what patients should know is that every physician is there to help you. Nobody's trying to cut the rug out from under you, or intentionally hurt you, or trying to use you, or trying to gain monetary advantage from you. It's We're just there trying to help you. And so the patients, you have to explain to the patients, you can trust me. I think building trust is important. So the first time it might be difficult, but afterwards, if the patient gets to know you, they can trust you. And so when you tell them, okay, let's go with plan A rather than plan B, they can say, okay, this is my doctor. They have shown me in the past that they are reliable, so I'm able to trust them. So building trust, being firm, setting your boundary, and then I think also not shaking from that. Like, you be firm. If you're firm today, stick with that. Don't say no and then change it later on, because you're giving the patient the impression that you can be fickle, and if they yell enough, or if they cry, or if they do something, or if they threaten you, then they get what they want. So it's a fine line, but I think being diplomatic, being firm, setting your boundaries, and clearly explaining the situation can go a long way.
wow, wow. Thank you for that powerful answer. But I am going to take Norma on a bit of a controversial thing, because as you were talking, one of the things that comes to mind, and this is something I just didn't pick up just from medicine alone, but also in life, and that is it's very, very difficult to correct behavior,
Mhm.
even when that behavior is error, is in the wrong. And so, as you are talking about being diplomatic and all that, I see in many instances where that works great, that works fine. But in other instances, for instance, when we talk about the opiate situations that we have in this country, most of the time this doesn't work. And I don't blame patients necessarily, because at the end of the day, no patient really came to a doctor and said, hey, write this opiate. Well, maybe they did, but at the end of the day, most of these patients on opiates who at this point they've been taking for decades, it's more of a behavioral thing. Will scream and yell, and for all right reasons will say, hey, you depriving me of something that another doctor had given me, and it has worked, it has taken away my pain, and now you telling me you cannot give me opiates, opiates are bad for me, and now I am in pain. So Norma, please help us. How diplomatic can you be with such a patient?
as diplomatic as will get you through the visit, operates within the standards of medical care, and still take care of the patient. So it takes patience. I think to start with, we always have to listen to the patient and be empathetic. That's part of the issue. A lot of people, when they come in and they're in pain and they're frustrated, they want to be heard, first of all. They want to know that we can understand where they're coming from, or at least sympathize or empathize with them. And they don't want to feel like a number. They want to know that they are heard, and we will validate their concerns, first of all, and then explain things to them and outline all the different options. And then we can make a joint decision about the next steps to go forward. Yes, it doesn't always happen in that organized fashion, especially when patients are extremely frustrated and they came in wanting one particular thing, or they want the pain to stop. Part of what I try to do is also explain to them realistically that I probably won't be able to take away 100% of your pain. I want you to understand that, because expectations matter. Sometimes they come in and they feel like they're going to get treatment and it's going to take away everything. But then when that doesn't happen, they feel like they were not taken care of. So I try to be realistic with them and tell them, look, I will probably not be able to take away 100% of it, but I can at least help make it less um, burdensome and less painful. So bring down the pain from, let's say level of 8 or 9 to 5 or 6, and then we can continue to work from there. And I explain the risk benefit indications and why I am recommending one thing over another. Again, it doesn't always go in that fashion, but from my experience, that has helped me get through some tough visits with patients. Some, we're not able to reach a compromise, and the visit has to end prematurely because we're not able to get through a doctor patient relationship, build trust, walk through a treatment plan. And sometimes they end that way. But for the most part, I've been able to get through some of those hard discussions and actually get some patients off of these meds by explaining and just first of all hearing them out and listening to them. I think that's really half the battle. And even when we're not dealing with pain, a lot of it is the patient wants their concerns to be validated. Part of it is they want to see that you're doing something and you're hearing them because they've gone through several people and they haven't been heard. So that's part of their aggravation. So when you calm them down and you are able to validate their concerns, that yes, I know you have pain. Yes, I know this is serious. And we have to act like it and not just say it. So that's important. They want to see that. I think I would want to see that if I were in pain and I went to see somebody. If they just brushed me off, I wouldn't be happy, you know? And that is especially true for a lot of minorities and patients like sickle cell patients dealing with pain. They're always in pain and they go through pain crisis all the time. But you read about a lot of accounts where their pain is swept under the carpet and they're treated like they're drug seeking. Whereas, no, they're just dealing with this. And, it just takes someone being a bit more patient and actually understanding what sickle cell is and what the pain crisis episodes are. So cases vary, but generally that has helped me navigate a lot of these difficult situations.
Wow, thank you so much, Christine and Norma. I want to turn our attention just briefly to workplace culture. Because one thing that I have personally noticed is that patients know. They know when they are in a workplace where there is toxicity. They know when they are in a workplace where there is camaraderie and there is a teamwork and things like that. So, how do we change workplace culture? We will start with Christine. How do we go about bringing about change? And then after you're done, Norma will help us with workflow and how we can care for our patients in a better way from that perspective.
I think clear communication is will go a long way to help with that. So trying to figure out what exactly the problem is, because it can be a wide range of things. It could be a lack of respect. It could be communication issues in the way somebody says what they want or says what they need. It could be a lot of things. So communication is the key, to talk to whoever you're having the issue with, to say, okay, this is my perspective, this is what's going on. Can you explain to me what your major concern is, or why we're having this problem, or having somebody else mediate, if it's specific between two people, and someone else that can be objective, the office manager, or somebody administrator, somebody else, depending on what's going on. It's going to vary, and it's going to vary based on people. Sometimes it could be also cultural as well. Some people might not be used to taking, not necessarily orders, but answering to somebody from a different culture from them, or somebody else. The way that they say what they want might not be the way that somebody else is used to receiving it. It might be more curt. They might want someone else to be more friendly when they are not actually a friendly person, when they just want to focus on the job. It could be a lot of different things, but I think communication is the first thing. Being open to change, being open to be able to adjust things that might need to be adjusted, being receptive to positive criticism as well. So I think if you start with communication, being willing to change, and being open to positive criticism, that's at least a start to help with workplace relations.
Wow. Wow, thank you very much. And Norma, so that is the general workplace culture. Now, when it comes to some place like medicine, where it's ever so important that the team functions as well and efficient as they can, to be able to care for the number of patients that need to come in a reasonable amount of time, and also even to set the expectations. Sometimes I have my assistants setting the expectation for what patients to expect when I walk in the room. I think that so in the field of medicine, this is ever so important. So, can you help us with workflow and what to do when there are issues with the workflow that eventually will impact patient care?
Yeah, so workflow, you have a team, and the you we always hope to have a dream team. Essentially, I would say. So, really, from my experience, the overarching concept I would use is practice makes perfect, and being professional. So we're all adults. We're all hired for a role, and we all should know our roles. That's the first thing. When we all know what we're meant to do within that team, and we know how to support each other, it will go smoothly. So, of course, like Christine mentioned, the communication part really helps everything go smoothly. But we all have to know um, how our role affects the next person, and how we can do, they call it the warm transfers and all that. So, being professional and staying in our lanes is very important. And knowing that we can always fine tune things, and we can practice a certain way, and then checking to see how that is working. So at every step in the journey, we can check in and see how we've been doing things over 3 to 6 months, for example, and then see if we're actually achieving our target goals, and then improve things in terms of being faster, but safe. Because again, safety is important. So with medicine, you do have to be quick on your feet, but we have to be safe. So we have to keep all those guardrails in place. But number one, be professional, know your role, and then keep trying to fine tune things and improve it. And from the front desk staff, all the way to the physicians and the ancillary staff, all of that works together seamlessly, and respecting each other's roles. One person is not more important than the other person. We all need each other to make this whole thing work. So, for example, I can't get my job done efficiently if I can't work with the social workers, because I can't do everything. I don't have all that time. And I don't necessarily want to be working till 12 midnight trying to carry so much on my back. So, delegate to people, and, check in with people. all of that is efficient. Checking in with the specialist. So it's really that teamwork, and the more we practice it, the better we'll get at it. But we just have to make sure that we are professional and we're respectful about that, and things usually work smoothly that way.
Wow. Thank you so much for that answer. We will be winding down soon on our conversation today, and I have maybe two, three questions for us to finish up. But I want to ask about we all practice in America, and the way we practice medicine here is very different. I'm not going to say it's better than anywhere else because, hey, the grass is always greener at somebody else's feet, right? The way we practice medicine, however, is very different. I mean, our cost is obviously very high. Everybody knows that. Patients complain about that all the time. Our politicians talk about it as a campaign point. So, what is the impact of corporate America in the practice of medicine? And where do we see this potentially going in the next few years?
But yeah, unfortunately, medicine has become a huge business. It's no longer putting the patient first, but it's putting the profit first. That's my opinion. And so that is not good for the patient. That's not good for the physician. It's only good for the big healthcare organizations that are running it and making the profits. So it's a tough thing to deal with. Because a lot of the times patients, like Norma had said earlier, they just want someone to listen to them, to care for them, to know that you are spending that time with them. But the way healthcare is going, it's more of a profit. So it's as many patients as you can see, as quickly as you can see them, and they are not getting the same time effectiveness. They are not getting the same focus that they had in the past. Before, a doctor would have maybe 30 minutes, with the patient. You can talk about your life. The doctor can call the patient and tell you about your results. If they have extra questions, you can call and talk about it. But now it's like, no, you have to spend this amount of time. You have to move on to the next patient. There's no time to call. There's no time to talk to any other patient. So it's become a business, just like a drive-through. Okay, who is next? Let's go. Who is next? That's the way that it has become now, unfortunately. And so it's not a good situation, and I think that's why a lot of physicians are going into their own practices where you can run things on your own, where you can spend the time that you want with the patient and do things your own way.
Norma, same question.
So with everything, there are pros and cons, right? But with how things have turned out with corporate medicine, insurance companies running things, it has not changed for the better, unfortunately. Um, I hope that things do change. That's always my eternal hope, that things will gradually improve. But there are just so many risks, and there are a lot of things that add to the burden of practicing medicine today because it's corporate run. And unfortunately, that leads to a lot of physician burnout. And I think we all know that the suicide rates for, in medicine are very high, not just with physicians, but with nurses and other allied health professions. So those are just a few of the things that we have to deal with every day. So that really, really interferes with patient care and how we ideally thought we would come out of med school and spend time building relationships with our patients. That is the biggest part. I spend more time, staring at a computer screen and working on the electronic medical record as opposed to actually walking one on one with a patient, talking to them. There are some benefits right now with the use of artificial intelligence and things like that. So yes, we love the fact that we have a lot more of engineering tools to take care of patients faster, and a lot of CT scans and MRIs to detect illnesses much quickly. So those parts we really appreciate and we're grateful for. But the overall outlook isn't on the positive side.
Wow. Wow. Thank you both for your candid answers. Christine, so I will ask you this all important question then. Our topic today for discussion is outward smiles, inward screams. So, for you as a physician, how do you go about internalizing these smiles so it becomes outward smiles because of inward smiles? How do we get physicians? I get what Norma is saying, that the burnout ratio is very high, suicide ratio for all in the allied health field is very high. How do we help take care of the people who spent, for most young physicians, the majority of their life training to take care of others? How do we take care of them? How do we get them to have these inward smiles and outward smiles as well?
Um, I'll say first, take a deep breath. Then I think for me personally, try not to take it everything that happens personally. I think that's something that has helped me. If something doesn't quite go the way that I want in terms of a patient interaction, I try not to take it personally. I try not to take it home with me. I try not to internalize it, so that way I'm not just thinking about it, or having that inward scream. So if you don't take it personally and try to fix the things that I can fix and the things that I can do. Then also have time for myself outside of medicine as well. Taking care of your mental health is very important, because at the end of the day, it is a job. It's a job where we are taught to be altruistic and where we are taught to sacrifice ourselves and sacrifice everything for the job. But at the end of the day, it's still a job. It's a job that we want to love. It's a job that we have passion for, because those of us that go into it truly want to help people. And so you cannot separate yourself from it, because it's part of who you are doing this job. And so it's very difficult, but I think being able to not take it personally and separate yourself from the job is the first step, because there are lots of things like we've talked about today, like the corporate medicine and entitlement of patients and things like that, that play a role to it, and those things we cannot necessarily change. But what we can change is ourselves, how we handle things, how we address things. So I just try to take a breath, don't take it personally, try to address the things that I can address and fix the things that I can fix, and let go of the things that I can't change, and then just move on from there. So that's how I deal with it. It might not work for everyone. Initially, it was very hard for me because I want to do a good job, and I come into work trying, and then you have people who are not happy. But at the end of the day, there are people who are not going to be happy regardless of whatever you do, and it's not up to you to fix that. It's not up to you to make everybody smile. It's up to you to do your job, and my job is to take good care of the patients. So as long as I'm doing that, then I can step away from personally attaching myself to it, and reassure myself, okay, I did the best that I could in this particular situation, and then I can walk away from it and move on to the next thing.
Wow, thank you so much. Norma, I will have you answer the same question, but then also in closing, if you can answer that and also speak a bit to issues of monitoring, where some physicians feel there is too much monitoring, whether from insurance companies, from corporate, and things of that nature. If you can speak to that, and for the providers or the physicians who feel there is so much monitoring, there's like Big Brother is looking on your shoulder with every turn or everything that you say. If you can say a bit to that also, in closing for us, so we can wrap up today.
Okay. First thing I would say in regard to the first question is definitely knowing where our identities lie. I think that is paramount, because if your identity lies in medicine, or saving a patient's life, we're going to be burned out. Because first of all, I mean, I might joke about it and say it's lightly, but we are all terminal, right? Nobody's going to stay on earth forever. We all have a finite amount of time on this earth, so we are all going to pass away at some point. So we're not the ultimate ones in control of saving a person's life. We're vessels used by God to help with keeping people healthy, but also helping them pass on to the next stage of things, at points where they're sickest or they're passing away. We're supposed to be there as a support system. So at different phases of life, we're there to help people get through those journeys easier. So again, we have to know where our identities lie. So if that's in our religion, our faith, and all that, then those are the real things that we have to tap into and keep paramount in our minds. So that way we can adequately keep a balance of taking care of ourselves first and then taking care of our patients efficiently. And that also feeds into, your boundaries from there, and then you know how to keep things realistic. I also joke about this with my staff, when there's certain expectations at work or from patients. One of the few terms I use is, I am not Jesus. I'm not expected to do the job of the Holy Spirit. So no, I can't wave a wand and then your upper respiratory infection is gone in one day. No, that's not realistic. If you have a
Oh,
virus
that's
or
such a
bacterial infection,
disappointment.
yes, it's going to take a while for you to get better. So you have to let things take their course. So those are a few terms that I use. I'm not Jesus. I am not meant to do the job of the Holy Spirit. I cannot carry that weight on myself. It's too heavy. I am just a human being. I'm one person. So I have to have that reality going through every day because it's tough enough. You're dealing with people sometimes at their sickest, sometimes they're healthy, but again, taking care of them at different phases. So it can be depressing when you see a lot of death happen time and time again throughout your day. And if you carry that weight of thinking you should have saved this person when you did everything right and you did everything you possibly could, then you end up eating yourself up inside, and that's not healthy. And that is why a lot of people find themselves getting burned out or more depressed as physicians. And we can't do our jobs that way. We can't take care of our families that way. And that is a very unhappy way to get through life. So, knowing what your limitations are, and again, it all goes back to your identity. So, peace is really not the absence of storms. We're all going to have storms in life. There's going to be all kinds of things brewing, but peace is really your level of calm in the midst of everything going on around you. So your approach to things really, really matters. Having that balance and that mindset will get us through most of the toughest battles that we encounter. So that would be my approach to number one. Number two, in terms of the physician monitoring and insurance, in a rational way, I understand that there have to be some monitoring and appreciate that the government steps in with certain things like controlled substances and opioids and all that because we cannot carry that weight of monitoring by ourselves. It's just too much.
Correct.
And it's important to have a database and the government, the DEA, monitoring all those things so things are not misused. So those things are important, but micromanaging can be a problem because no adult wants to feel micromanaged all the time. And nobody wants to be told how they should take care of their patients, by insurance companies or different bodies who are not physicians. So that part is the frustrating part of it. So definitely, I think in terms of physician reforms, we need to really get a good handle on it. And this is why a lot of times physicians are we're begging other physicians to try and get into leadership positions and lobby and advocate because we need physicians at every level to help us because we can't do everything on the ground. We're just whining and we're complaining and we're frustrated, but we have to step up to the plate and try and change and advocate for reforms. That's the only way we're going to get things to actually improve over time. So some of us do need to try and push for things like that and actually go to Washington and advocate for things and get on a lot of these committees that will really help us actually get changes done. Because at the end of the day, in future, things would get better if we're able to do that. So just like we're in a voting season, you have to use your voice. You have to be able to explain and say what you hope to change. If you don't use your voice, then nobody's going to hear it. Nothing is going to change. So if we keep doing the same things over and over again and we expect something to be different, it's not going to happen, you know? So we have to really try and get out of our comfort zones and actually get out and do the work that needs to be done. It's a challenge. It's not easy, but we have to do it unless we're not going to get easier ways of getting meds approved for our patients. And a lot of us might end up leaving primary care, which is disastrous because primary care is the foundation of taking care of patients everywhere. That's why
True.
it's primary. So if all of us just abandon it because we're frustrated, then who's left to do it? you know
True.
so we have to try. It's not easy, but we have to learn these things. Nobody really teaches us, but we have to teach ourselves, and we can do it because through medical school we have to teach ourselves a lot of things. So what's the difference? We don't have two heads. Can be done. So
Sounds good.
we yes, so we really have to try and look at the big picture and see where we can join a lot of these groups and advocate properly so that things are done. Those There are a lot of people doing it now. There are a lot of people leading leadership positions, in these companies and trying to effect change. So we're grateful for those people, but some of us have to try harder. So it's all about getting a balance. We need some monitoring, but we can't be micromanaged. So we have to meet in the middle.
Sounds good. What a powerful section of Hour of Healing. It's not always that we get the opportunity to actually bring healing to the people in our communities, in our healthcare center, who are doing the work to give us physical, bodily healing. So I can't thank our guests enough today. I will be going back to Dr. Christine Tolu Ajayi to wrap up for us today. Outward smiles, inward screams. Dr. Tolu Ajayi, what would you tell our physician friends out there, or people who are even in corporate America who actually are just burdened with their desire to do good for the community, to see the goodness of humanity portrayed, but still they themselves are undergoing burnout? Any other healing words that we will share with them today? I know we've covered a lot.
Um, I would say keep fighting the good fight, but remember that you have to be able to fight the fight. So take care of yourself first, that's important, and then keep doing the things that are right. Have your boundaries, stand by them, and be open to accepting things, and also be willing to use your voice and fight for the things that you feel are right. And don't be afraid to step out and make some change. Don't be afraid to be the one to rock the boat, or shake the tree a little bit. It might come with some consequences depending, you might have to move over to somewhere else where you are able to do the things that you want to do. It might involve you changing jobs, switching jobs, starting your own practice. Practicing medicine the way you want comes in different ways, but at the end of the day, you are the one that has the power to make those choices, and you can bring about change. You can be support and help for your patient, but you have to also be able to take care of yourself. And so I would say you are not alone in this fight. We are all here trying to do the good thing, try to do the right thing. We are still passionate about what we do. Our goal is always to help people and help people smile. We want those outward smiles as well. We want them to be real outward smiles. So I would say, take care of yourself, keep doing what you're doing, keep being passionate, and don't be afraid of change.
Wow. Wow. Thank you so much, dear audience, for sticking with us for these 2 weeks of recording. And also to our guest, Dr. Norma Ubona, who again is a family physician provider and a wound care provider in the Ohio region, and Dr. Christine Tolu Ajayi, who is a family physician at Emory in the greater Atlanta region, Georgia. Friends, we are so thankful to God for the grace He continues to give us week in and week out as we bring you various healing topics. And I mean, this was very powerful. This was very inspirational. I need to take some vacations from work, definitely, after listening to this. But this was great. And we are so thankful that each week you tune in, share with your physician friends that you know, so that they can also be able to get the healing that they need. And we will join you same time next week with another life-changing and thought-provoking topic. And don't forget to follow us on Instagram each week as we post reels to kind of give you teasers of the various conversations that we have recorded or will be recording, so that it will be to your benefit. God bless you so much, and we will see you same time next week. Bye bye.